Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Modupe. Sound Health airs every Tuesday at 6:30 p.m., bringing you trending health issues from around the world. Today, we are looking at a vital role in healthcare in Nigeria and all over the world. It is called the pharmacy practice. Despite its critical role, the practice experienced policy gap and other challenges. This is our focus today. The program continues in a moment. Please stay tuned.
You hold me, you keep me safe, you are my world. Not every baby gets this chance.
Every 7 seconds, a mother or baby is lost to causes we could prevent. Not enough midwives, not enough medicine, not enough time. But this can change when we invest in science, in strong health systems, in equality, when we make the choice to support mothers and babies, when birthdays are moments of hope, not loss. We protect the future. Because every healthy beginning means a hopeful future for us all.
The program is still Sound Health on Lagos Television. Joining us via Zoom this evening is pharmacist Babayemi Oyekunle, FPSN, Chairman, Pharmaceutical Society of Nigeria, the Lagos State Chapter, and he is going to tell us what exactly is the pharmacy practice and how can we ensure that this practice is enhanced for optimal effects in the health care and especially in patient care. Good evening, Pharmacist Oyekunle, and thanks for joining us.
Good evening, viewers. Good evening, everybody. Thank you very much.
All right, Pharmacist Oyekunle, the pharmacy practice holds a vital role in the health sector in Nigeria and everywhere in the world. But unfortunately, many people still feel the practice is undermined by so many challenges as well as underutilized. How true is this?
The truth actually is that there are best practices all over the world to every profession. The pharmacy profession is a recognized healthcare professional all over the world. And the roles of the pharmacists, cannot be overemphasized in healthcare delivery all over the world. Unfortunately, in Nigeria, when we decide to, only adopt the things that suit us, or for our selfish reasons, we decide not to allow every professional to practice to their optimum, to actually contribute even to their quota to healthcare delivery. We will be having healthcare challenges. And that is the truth.
Beyond dispensing medications, retailing, managing a pharmacy care or community pharmacy care, what are the less known but very vital activities and practice by pharmacists?
The pharmacist is actually the healthcare professional that is actually the expert, is the one that actually know everything about drugs. Unfortunately, most people think the work of the pharmacist is just about dispensing, but there is another serious job. Let me use the word job now, or serious interventions that pharmacists makes in healthcare delivery. That is in area that we call counseling, or what the totality of what we call pharmaceutical care. You know, interventions in every parameters that, you know, has to do with drugs, drug interaction, drug, you know, how the drugs should be taken, when to take those drugs, those side effects that the patients may actually have if they take the drug, and so everything that pertains to the drugs, the pharmacist is the expert on it. So dispensing is just a very minute part. In fact, dispensing is a part that a cadre of pharmacy even partake in. These people, when we supervise them, that is the pharmacy technicians. But above all that, the truth is that before anybody takes any drug, they must be counted. They must be told what to expect when they take those drugs. They must, you know, we must look at, if they take those drugs, what will happen if they take it with another drugs, and so many other things. But the gamut of it is that there is a word called pharmaceutical care. That is about about the patient, making sure when a patient takes drugs, the expected outcome is what actually comes out.
It is obvious that even in communities, low resource settings, the pharmacy is the first point of contact for anything, a medication and all that. Even before going to the hospital, you see many people self-medicate. That is where points of contact, patient care comes in now. So tell us, how do you think we can upscale this so it won't look as if it is just about self-medication and over-the-counter purchases we are looking at?
Yes, there is what we call responsible self-medication. That is recognized all over the world. But it is for the professional, especially the pharmacists, to guide, you know, patients and, you know, clients about drugs. Unfortunately, you know, because of the climate in which we operate, when supposing somebody comes to you now and you are confirmed this time around, because it is each time that you have to confirm. This time around, you have confirmed that it is malaria based on certain symptoms and based on, you know, there is what we call rapid diagnosis test that is now available. And we have now, recommended, since we are talking about OTC drugs now, we have now recommended, take this anti-malaria with paracetamol and maybe with, let's say, because they are OTC, with vitamin B complex. It is not that each time you have the same symptoms, or if any other person have the same or have similar symptoms like you had before, that you must take what the pharmacist or the doctor had prescribed or the pharmacist had recommended, that is what you should supposed to be taking each time you have anything similar to what you have had. You must still see your doctor if the doctor needed to actually make another diagnosis, or your pharmacist if he needs to recommend some other things. Not that because you are having pain and now you know that paracetamol is for pain, you must be taking paracetamol. So a pharmacist must guide you, because as common as paracetamol is, paracetamol can also cause trouble, especially for the kidney. When people take a lot of paracetamol, they can damage their liver, they can damage their kidney. In fact, nobody should take more than 3 grams You know, even though 4 grams is recommended, but we are saying nobody should take more than 3 grams. That is 6 tablets of 500 milligram paracetamol every day. And it should not even be continuous. Because you know, most drugs you will see is written, even OTC, that if after 3 days you are not okay, you should consult your doctors. That is what should actually happen all over, even Nigeria. But unfortunately, this is not so.
All right. That brings me to my next question. I know people do more than the laxatives, antidepressants, and all that. And I also know that some pharmacies, some A-list pharmacy, do not allow people, buy drugs except with a doctor's prescription. A major problem currently experienced in Nigeria is getting medication from approved or unknown sources. What is your profession doing to check this? Are you looking at partnership with other regulatory agencies? Because that is a major problem.
You see, this is a very serious question, because the truth is that the way drug is being distributed in Nigeria, there is a serious problem. Drugs are not readily available in saner climes. You know, you can't just decide that you want to go and take any drug and you just get to a drug medicine or pharmacy and you will just call and say, okay, I need so drugs, and it should be given to you. No. The truth is that there are some drugs that have to be prescribed before they are even given to the patient. That is one. But unfortunately, we find out that most of our clinics and hospitals, they just, or even professionals, they just write anything, and people are made to just go and purchase their drugs anyhow. That's one. Another issue is this issue of distribution of drugs. You know, in Nigeria, if anything happens now and you need to recall, it may become very, very difficult. What we mean by recall is that maybe for one reason or the other, it's been discovered that a drug is not good, or a batch of a drug is not good, and you needed to now say, okay, let's get this drug back before other people get access to it or use it. It becomes very difficult because we have been saying to the government, the shame of distribution of drugs, you know, we must do something seriously about it. And the one way that we have suggested is that there must be coordinated wholesale centers. This is what we mean, that drug manufacturers, or drug importers, when they manufacture or import any drugs, they cannot just sell to anybody. They will go and sell it to these coordinated wholesale centers, which government is expected to build. We've been telling the Lagos State government time and time again that they needed to build this coordinated wholesale center, so that when manufacturers manufacture drugs or importers import drugs, they first go to that coordinated wholesale centers and give registered wholesalers or distributors these drugs. These are registered people because NAFDAC will be in such location. NAFDAC controls, you know, drugs and drug products, you know, everything about drug and drug products. Then there is the Pharmacy Council of Nigeria that controls licensure for the pharmacies to be sure that the person who wants to give out those drugs or who is in charge of those drugs are pharmacists, then those people, those two regulatory agencies will be in this coordinated dosage center. Retailers will come and buy from there. Those retailers cannot just be ordinary retailers, because you see on the street drug hawkers. How do they get all those drugs that they are hawking? Where do they get them? But if we have that manufacturers, importers of drugs cannot sell to anybody except coordinated dosage centers, where NAFDAC and PCN will make sure that only registered pharmacy and pharmacists can buy from those places. So these are retailers, and this one, they will be documented because everybody have license number and all that and all that. So those retailers, because they are professionals, they will only dispense those drugs as they ought to dispense it. So you will not find hawkers and people going around the street, selling drugs. Some are fake, some are substandard, some are not even what they are supposed to be, because the conditions in which they even keep those drugs is another problem. When drugs are being kept in the open sun, the truth is that most of those drugs are denatured. Like, let's say paracetamol that is 500 milligram. If supposing the people really bought 500 milligram paracetamol, by the time you analyze it, you will find out that maybe it's less than 50 milligrams. And they will say, okay, when I use that paracetamol that I'm not well, it's because the truth is that those drugs are not what they ought to be again. They are not drugs again. They are, let's say, we could just call them maybe placebos. That is, drugs that cannot do anything. That's one aspect of it. Another aspect is that these are avenues for, circulating banned and dangerous drugs, because there is no control. Nobody knows where they have gotten those drugs. Banned drugs that, like narcotics, drug of abuse and all that, you find it with these hawkers and with all these unregistered pharmacies. That is the problem we are facing in Nigeria. You see, the pharmacy, we cannot do much because we don't have the force of enforcement. We cannot, we are not the police. We are not a government agency that has even the power to arrest people who are selling fake and adulterated drugs. The only person that can do it is the government through their agencies, police, NDLEA, and all that. And unfortunately, well, I will commend NDLEA in their own aspect, but there are so many gaps that needs to be filled, and that is the truth.
All right, thank you so much for that detailed explanation. So the new PCN Act 2022 aims to strengthen pharmacy practice. How do you think this act will benefit or improve as well as enhance patients' care, so they can actually benefit from this act?
The things that needed to be done is in that pharmacy law of 2022, that anywhere drugs are being stocked, anywhere drug is being sold, anywhere drug is being dispensed, anywhere you have drugs, there must be a pharmacist. You know, a pharmacist is somebody who has gone to the university for 5, 6, even maybe at times in some cases 7 years to go and read a course called pharmacy. And with that, when he graduates, he becomes an expert on drugs and drug matters. So what is expected is that before anybody can stock or drug in any place at all, there must be a registered pharmacist who knows how to stock, when to dispense, what to tell the patients about those drugs, and he will tell the patient about the outcome. If you take this drug, you may sleep. If you take this drug, you may want to vomit. And this is what you should do. So in any place drug is being sold, the law, that pharmacy says a pharmacist must be in control. That is one. In that law also, it is expected that the pharmacist must be in charge of any drug, premises, whether it's importation, whether it's production, whether it's wholesale, whether it's retailing. So there must be a professional, a pharmacist, who will be in charge, who can be held responsible for what happens to the patients if they come to him and he dispense or advise or counsel them on those drugs.
Okay.
That is the spirit of that pharmacy law. But unfortunately, the pharmacy law, the enforcement is lacking. We have a lot of, drug places. Let me not call them premises. We have a lot of hospitals that have drug stores that gives out drugs without the pharmacist being in charge. And that is a problem. So let me tell you, because the public must hear this. It is, in other climes, you can never see a drug, given out to anybody without a pharmacist intervening. Because what the pharmacist is supposed to do is much more than dispensing, like I've told you. It can look at all those drugs that have been prescribed and decide that if this patient is allowed to take this and this drug that have been prescribed, there will be interaction. There are some patients that have some underlying problems. If he is allowed to take this drug, it will not be good for this patient. So the pharmacist will now go back, phone. There should be an avenue for that, but unfortunately, most times it is not. Phone the doctor that have prescribed the drug that, my physician, such drugs that they are prescribed, in the interest of this patient, maybe we should not give these drugs, we should give this drug, or maybe we should just take away this drug out of this prescription, so that we will be able to actually make sure that this patient is getting what he or she ought to get. So that is what we should be doing, but unfortunately we are not doing it.
Coordinated wholesale drug centers, improved regulation, and advanced patient care have been major high points during the interview with pharmacist Babayemi Oyekunle, FPSN Chairman, Pharmaceutical Society of Nigeria, Lagos State Chapter, on how to improve pharmacy practice in Nigeria. We bring you the concluding part next week. Please plan to join us. Sound Health continues with trending health report from around the world. Please stay tuned. say thank you on today's episode of Sound Health. Hope you've been enlightened about the pharmacy practice in Nigeria. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. Sound Health is a sound mind. Make healthy living your choice.